Hello, ladies and gentlemen. Happy Ramadan. Today we'll discuss an important subject for a lot of patients. As a subject, we'll explain chronic liver disease and Ramadan. As regards chronic liver disease, there are many causes for etiology of chronic liver disease. But in Egypt, we can classify the etiology of chronic liver disease into mainly three groups. First one is chronic viral hepatitis, and this is very important in Egypt, and this is considered endemic in Egypt. A second group is chronic non-viral hepatitis. Third group, bilharzia liver fibrosis. As regards the important group of etiology is chronic viral hepatitis. There are many causes for chronic viral hepatitis, but the most important in Egypt is two viruses, mainly B and C virus infection. As regards the A virus infection, it is common in young age. This is considered as an acute hepatitis, and this is not led to a lot of complication. But the most important in Egypt is virus B and virus C. Virus B, there is a marked decrease in the incidence of B infection now, but virus C still it is an important cause for chronic liver disease. As regards the clinical pictures of chronic liver disease with viral hepatitis, there are many manifestations for this condition, such as weakness, easy fatigue, anorexia, loss of appetite, and even the condition can progress and patient starts to suffer from jaundice, dark coloration of urine, abdominal enlargement, edema of lower limb. There is a lot of manifestation for this patient. But as regards the clinical view, we can classify also the clinical picture of chronic liver disease in Egypt in mainly two groups. First group, chronic liver disease with compensated liver. Second group is the chronic liver disease with decompensated liver. As regards the first group with chronic liver disease and decompensated liver, this patient has no manifestation of liver cell failure, such as bleeding tendency, bleeding from the nose, history of hematemesis, abdominal enlargement, ascites, edema of lower limb, jaundice. There is no manifestation of liver cell failure in this patient. The patient may suffer from minimal manifestations such as weakness, easy fatigue, dyspepsia, mild edema of lower limb, but patient can do effort and no serious manifestation in this condition. As regards the second group of chronic liver disease with decompensated liver, this patient considered severely ill and suffer from many manifestations like edema of lower limb, abdominal enlargement, ascites, jaundice, yellow coloration of the sclera, dark coloration of urine, perioritis, itching at the night. Even patient may suffer from manifestation of complication of chronic liver disease, such as repeated attack of hematemesis, repeated attack of hepatic coma, or chronic encephalopathy. As regards the investigation of chronic liver disease, especially chronic viral hepatitis in Egypt, there are a lot of investigation for this condition, but I would like to express limitation for the investigation. At first, we do a liver function test to do the condition of the liver, such as serum bilirubin, Sugot and Segept, alkaline phosphatase, serum albumin. Second, we do abdominal ultrasound, and this is very important to assess the size of liver, size of spleen, presence of ascites, diameter of portal vein, detection of portal hypertension. Third, can be do endoscopy, upper gastrointestinal endoscopy, especially to detect esophageal varices, and this is very important because there is a serious complication for patients with chronic liver disease. Also, we do a hepatitis marker to know the type of virus in this condition, virus C or virus B, and recently we can do PCR to detect the level of viremia in the blood of this patient. This is mainly the investigation for this condition of patient with chronic viral hepatitis, especially virus B or virus C. As regards the complication of chronic liver disease, chronic viral disease, there are two serious complications. The first one is repeated attack of hepatic coma, and this especially occur after excessive intake of meat, exposure to infection, use of diuretic, and this is considered as precipitating factor, and a patient in this condition can be considered as a serious condition, should be hospitalized. The other serious complications is presence of portal hypertension or esophageal varices, and patients suffer from attack of hematemesis, and also it is one of the serious complications for chronic liver disease or chronic viral hepatitis in Egypt. As regards Ramadan for this patient, at first should be examine the patient very well and do laboratory investigation to assess the group of patient. If patient is considered as chronic liver disease with compensated liver, no manifestation of liver cell failure, this patient can fast in Ramadan with some restriction about the diet, to be take good meal, small frequent meal, no excess of meat, and this patient can fast in Ramadan with a follow-up of investigation like liver function test every 2 weeks. But the patient with decompensated liver disease, a patient with chronic liver disease and show manifestation of liver cell failure such as jaundice, ascites, edema of lower limb, give history of hematemesis, give history of repeated attack of hepatic coma, or history of chronic encephalopathy, this patient cannot fast in Ramadan at all. And this patient is very serious to fast in Ramadan, because this patient need to take medication all over the day and should be take a meal every 4 hours, every 5 hours, small frequent meal, and should be the meal contain some restriction as regard fat, some restriction as excess protein, but increase of carbohydrate. This as regards chronic liver disease and Ramadan, and collectively can be considered the patient compensated liver disease can fast in Ramadan, but patient with decompensated chronic liver disease cannot fast in Ramadan. As regards the other group of causes of chronic liver disease, such as chronic non-viral hepatitis, bilharzia liver, as a chronic non-viral hepatitis patient also can be clarified as regard if there is compensated liver or decompensated liver, and patient with chronic non-viral hepatitis and the liver is still compensated can fast in Ramadan with some precaution as regards the etiology of the condition, especially as regards the diet of the patient in this condition. As regards the bilharzia condition or bilharzia liver, the third group of chronic liver disease, now bilharziasis incidence is in marked decrease, and the patient considered as bilharzial fibrosis, not cirrhosis, and this patient also, if there is no active bilharziasis and the condition of the liver is compensated, this patient can fast in Ramadan. But patient with active bilharziasis and the liver suffer from decompensation or manifestation of liver cell failure, I think this patient cannot fast in Ramadan. Good luck. Another meeting, we'll discuss another subject.